All right, good afternoon, everybody. Here to talk a little bit about October 8th, which is reopening for Phase 3. I've got the A team with me, Josh and Deirdre and David and Paul here on Teams. Just a quick update. You can see here in our daily summary, 384 cases. That's still a lot of cases, but out of 27,000 tests, that's a positivity rate of 1.4%. That's been pretty steady now for some weeks with a little bit of up and down in there, up compared to where we were a few months ago, but steady since September and schools and a lot of what's happened. Hospitalizations down 10. That's been bouncing around a little bit, creeping up over the last month. Really happy to see that, and always heartbroken to see the fatalities. Another 5 fatalities. All right, Phase 3. What are we doing and why are we doing it? We're increasing capacity for a lot of indoor events. The reason we're doing that is in part because we have a low infection rate, in part because it's colder weather and things are moving indoors. Restaurants in particular going from 50% to 75%, personal services, hair salons, libraries, and the such. So Dr. Deborah Birx was with us this morning over at UConn Hartford. And I think you know her maybe a little bit from the COVID task force and her flashy scarves. And, she was interesting as she gave a few of us a ride, a tour de force on what's going on around the country. And she pointed out when it comes to our Phase 3 reopenings in general, compared to April and May where infections were more widely dispersed, she made the strong case that workplaces, restaurants, schools, that's not where the infections are taking place. The track and trace, very detailed in Utah, found that 80% of their infections over the last month, and they did ramp up quite a bit, all took place in the informal social gathering. For example, Thanksgiving is coming up, and she made the case that, look, perhaps Thanksgiving at a restaurant is relatively safer because the tables are socially distanced, you're more likely to be following protocols, and less likely to be doing it if you're just hanging with your friends at home. Those that, are good friends of your good friends are there so you can relax your guard. She said Utah and other examples have reminded her that it's those informal social gatherings, something Deirdre Gifford has told us about for some weeks, and Dr. Birx reinforced that. So that's why when we look at restaurants and personal services and libraries, we're finding, looking around the rest of the country, we feel comfortable opening them up to 75%, because that is not where we've seen the infections taking place. Outdoor event venues, we've always been trying to promote outdoors wherever we can, expanding that from 25 to 50%. Indoor performing arts, similar. Bars and nightclubs staying closed. She reminded us, looking around the country, that even those bars in particular were risky. Even capping the hours was risky. Sitting down, Deirdre, she said, as opposed to standing up, made a bit of a difference, but it's pretty tough to police that in a bar-like situation. The next chart is a reminder of gathering sizes. And I think you'll see under indoor Phase 3, 50% capacity, capped at 100 people at that event venue, at that restaurant. In the private residences, we're keeping that at 25, which is where we were before. And that, again, is a response to what we've seen around the country, and Dr. Birx reinforced that in that event venue, that commercial space, you're much more likely to be careful and a lot less likely to be careful and less likely to be patrolled and follow the protocols in those private residences. So that's why we followed that. Graduations, religious ceremonies. Her input on religious ceremonies I thought was interesting. She said, for example, when you go to the house of worship, it's much more effective to tell people where to sit rather than where they can't sit. Right now, you probably, you see lines where you can't go sit. She said, put the green spots where you can sit, which makes the social distancing just easier to enforce. But of more interest to me was, she said, say the church services, people aren't getting infected necessarily at the church services, or less likely. It's your way into the service and your way out of the service. Your way into the service, you see old friends or friends of friends, and you high-five and hug and say hello, and you're very informal, your guard is down. And then once you get in the church, you put on your mask, probably a little more formal and a little more distanced and a little more careful. That was her message, and I think that resonated with me, why we can move to 75%, even though we're at 1.4% positivity, still one of the lowest in the country, I might add. But reminding people how important it is in their social interactions, the informal interactions, that's where the risk can be. And let's face it, October, November, she reinforced, are going to be months of risk. Finally, I guess I can point out there in terms of graduations, universities, we did meet at UConn, Hartford, and it was, she pointed out that over half the universities in the country are not open. They're not open for any in-person learning. You know, really all of our universities are open. Trinity has had a brief respite just because of a spike up there. UConn, for example, 1/3 of their classes are in person, which is a lot more than most other universities right now. UConn done that very successfully. They have a 0.6% positivity rate. Again, on campus is much safer. The off-campus activities, higher risk. In the classroom, much safer, K through 8. Outside of the classroom, higher risk. That was what they reinforced. She pointed to Clemson, which has been open for about 8 weeks, and showed the bell curve there, where that first few weeks was highly risky, and it was a bit of a bell curve, and those that were most likely to party were partying. There was a spike up there at Clemson. A fair number of people did get infected early on, and then that was the 10% that were most risky behavior. Then they're on the down ramp now, and they and a lot of those other southern colleges, which have been open for some time, have done a good job of containing things with regular, weekly testing across the board. This next chart is something we're going to focus on on a weekly basis. It's the current alert levels by town. We're finding again that the Norwich and the Danburys, you can have a flare up there in that town, and we want to focus on that and give you reminders of where we stand there. I think you can see overall that, let's say, Connecticut is at about 7.5 cases per 100,000, which is pretty good. I think you can maybe look around, and if you've got really good eyes, this is a reading test, you can see perhaps where your town stands. And that's why all those towns are moving on to phase 3. You can see there are a number of towns there that are in the red and the orange: Wyndham, Preston, Norwich, New London. Norwich and New London are dark red, meaning most infected, 25 plus. I'm told Norwich is higher than that. Where, right now, we're thinking about what should be the protocols going forward. Should we give towns like that the discretion not to move to phase 3? And right now, they're at much higher risk as we look around the rest of the state. I think we're thinking about this on a town-by-town basis, and perhaps giving those towns some discretion not to move to phase 3, to stay at phase 2, just like you've seen with the schools in Danbury and Norwich, and I think Preston now, if I'm not mistaken, where they decided to move to all distance learning, just as they're on their piece of the bell curve, which hopefully goes down on the other side. Let's see. Deirdre, as you know, is leading the vaccine advisory group along with Reg Eady, and we'll put out the press release very soon in terms of who the group is that's on there. It's an incredibly diverse group made up of folks in academia, healthcare, state agencies, legislature, business, labor, municipal leaders, clergy, community organizations. And we have a couple of different functions there we're thinking about. One is just the science of the vaccines. When can we do it safely? How is it effective? How best to do it? How you allocate? What would be those priorities? It's worth saying that Dr. Birx recommended we can get from CMS the morbidities of all the different older people around the state, and target them in terms of those that have a pre-existing condition, and really focus on them as one example of how we can prioritize the vaccination. And finally, communication. That's outreach, getting the message out to people, why it's important to do and how we can do it safely. With that, we've got our A-team here and happy to take any questions.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Just going back to what you were saying in terms of potentially recommending to some towns to stay at phase 2, have those towns actually officially been told they can do that? And what prompted this change in thinking? Because originally you wanted the regulations to be statewide.
We did. Early on, April, May, June, we thought bars, restaurants, let's do that on a statewide basis. Here we are in October. My thinking is we found a lot of these flare-ups are sort of town by town, although Deirdre will tell you Eastern Connecticut has got a little bit more spread than the rest of the state as a whole. So I think we're going to make a decision over the next few days whether to give towns that discretion not to move to phase 3, stay at 50%, just like they've had the discretion to keep their schools open or move to all distance learning. But any of you want to take a crack at that?
Sure. Thank you, Governor. As the governor was saying, we are seeing that some of the increases are pretty localized, and we're not seeing generalized uptick in cases across the state. I think the map that the governor showed earlier is a really nice illustration of how the increasing levels really are focused in southeastern part of Connecticut right now. So there's some logic to having a more localized approach to some of these changes in the phases, and particularly some of those that might entail a little bit more risk indoors without masks, et cetera. So that's the kind of discretion that the governor is talking about.
And just to clarify, so businesses today that start expanding some of their operations potentially within days, they might have to roll back to a more restricted phase?
What we're going to do is on every 2-week basis do a rolling average to be able to keep that map updated in terms of those towns that have the higher infection and those that are safer. And we'll figure out very soon whether to give towns discretion to stay at phase 2 and not necessarily move to phase 3 at their discretion.
And just real fast in terms of Dr. Birx, who's talking a lot about the asymptomatic spread. Where does the state stand right now in terms of testing? Do people still need to have symptoms to go get tested, and what is the recommendation?
No, everybody can get tested, symptomatic and asymptomatic. As she pointed out at the universities, that the number of asymptomatic carriers to symptomatic is 7 to 1. So it's really important that that testing be done on a broad-based basis. Josh, anything to add on that? You like that?
No, I think it's very consistent with the strategy we've been executing for months now. That I think is, we've seen be a very key role in our ability to detect outbreaks and infections and keep our levels very low through the summer and into the fall. So it was good validation, I think, of the strategy we've been on for a number of months now.
Okay, thank you.
Channel 3 Eyewitness News.
Yes, Governor, sticking with southeastern Connecticut, how active is the state monitoring the conditions and the protocols at the casinos?
I can tell you at the casinos, we've been following that, working in close collaboration with the tribes, who I got to say, look, I looked at Arizona, I've looked at Vegas, I've seen flare-ups at other casinos. As you know, I had some concerns about opening the casinos. Right now, I think we're finding the infection rate is low. Not only are they testing all their employees, they're testing employees if they go home as well, just to make sure nothing's coming from the community back into Foxwoods or Mohegan Sun. I think in some of these other towns I was sort of interested, they are doing wastewater treatment testing as well, which I think is very interesting. I don't know whether we're beginning to do that at the casinos, but what that does is allow you to have an early indicator of what's happening. And we're doing that at our universities and a number of our municipalities now. And one of the things that Burke said was, rather than just simply always say, wear the mask and social distance, we can give you a highlight based upon the wastewater early radar system. That has had a real impact in keeping people close to home where they should be in those particular areas.
Got it. And, going back to Dr. Birx, she said that the virus is now primarily spread through those social private gatherings. And your executive order can't really reach into people's homes. So how does the state get larger gatherings like college parties that are off campus or Halloween parties under control?
Right now, I think it's working pretty well. We obviously did not change the size of the gatherings for the indoor private parties, be that at college or be that at a private home. A lot of the policing is, sort of self-regulating, I think. And so, Deirdre, maybe you have something to add in terms of what we're seeing in terms of some of those private gatherings.
I think there have been obviously some high-profile parties associated with colleges and universities. I want to say, though, that it seems that most of the students at our colleges and universities are working really hard to follow the guidances and the guidelines and to keep one another safe and their communities safe. So I want to say thank you to them for the majority who are staying away from the large gatherings. I think, as the governor was saying, and Dr. Birx reemphasized, this is really something that each of us has to take responsibility for in our day-to-day activities, particularly with coworkers and friends and family members whom we don't live with. It's such a natural human kind of reaction to feel like, well, I know this person, I'm friends of theirs. We can't, I won't catch COVID from them. But unfortunately, the COVID virus, doesn't follow those lines of behavior. So, it's really something that needs to happen with our day-to-day interpersonal reactions, and just get in the habit of always keeping that mask on, even if you're with close friends or family.
Governor, if I may jump in here too quickly, a lot of thought was given to the gathering sizes as we're entering phase 3, and in particular, this distinction between gatherings at a place of business or a place of commerce as opposed to the casual private gatherings that Commissioner Gifford was just referencing. We do believe there is a difference, and we want to make sure that these smaller gatherings where, as Deidre was mentioning, folks let their guard down, they feel more comfortable. We want to make sure that folks continue to have their guard up. And we think in places of business, they're going to be much more vigilant on that. So we are one of only 1 or 2 states that's drawing that distinction between private gatherings and these gatherings at places of business. And we're hopeful that'll continue to keep the transmission very low.
News 8.
Thank you, Max. Good afternoon, everyone. For Governor Lamont and Commissioner Gifford, I know we've seen an uptick in New London now, and I believe they were issued a COVID alert similar to Norwich and Danbury earlier. I know each is probably a separate entity, but for both of you, can you take anything that you learned from Danbury and Norwich and apply it now to New London, and then possibly moving forward from there?
Want to start with that, Deirdre?
Sure. Yes and no, because I think we're seeing that each one of these outbreaks looks a little bit different. I may have mentioned in this venue last week that the outbreak in Danbury was very focused in a small geographic part of the town, and it sort of stayed there. Because people did a really good job of listening to the advice and adhering to it, and the outbreak didn't spread geographically. What we're seeing in Norwich and New London is different. The cases seem to be more sprinkled throughout the geography of both towns, and we're also not seeing a particular area where they seem to be originating from. So I think the lesson we learned from Danbury, to respond to your question, is that when people answer the contact tracers, share the confidential information about individuals that they've had contact with, we can advise those people to isolate and quarantine. We can turn these outbreaks around. And the cases, week over week, since we issued the alert in Danbury, the cases have come down. So what that lesson means for Norwich and New London is, if you have been exposed to a person who's known to be positive, you need to stay home for 14 days, whether you test positive or whether you test negative. If you've had an exposure, you need to stay home. And if you're sick with COVID, even if you have very mild or minimal symptoms, it's very important that you stay home for the full 10 days or whatever your healthcare provider advises you. Those are the key strategies to limiting and turning around this kind of a peak of infection. You have to break the chain of transmission from those who are exposed to those who don't have the disease. So those are the lessons that we take away from the Danbury experience.
The only thing I'd add to that is we are part of a region. I think we found that out back in April, and we're going to find that out again. As you know, New York City, especially certain communities in Brooklyn and Queens, they're up at a very high infection rate. And also Boston is up at about a 4% positivity rate compared to our 1.5%. So we are not an island, but I think we're doing everything we can on a localized basis to contain our piece of this.
Will there be additional testing, say, in New London?
Yes. It's another lesson learned from Danbury is our rapid response team was very effective in Danbury in helping to flood a lot of additional testing into that community, help identify all the cases so that people can take the public health steps that Commissioner Gifford just mentioned. We did the same thing in Norwich last weekend, and we're doing the same thing partnering with the Ledgelight Health District in New London this weekend through next week. I think we've got over a dozen new testing events set up. They're all on our website, on the New London and Ledgelight Health District website. If people have questions, they can always call 211. But we are providing a tremendous amount of additional testing through our rapid response team, as well as additional contact tracers from our state contact tracing pool to assist local health departments who may need additional assistance if the case volumes increase as they have in the southeast part of the state.
News 12 Connecticut.
Hi, everyone. I just want to clarify the towns that may get to opt out of phase 3. Just to be clear, if you're going to release a list every 2 weeks of towns that could potentially opt out of phase 3, am I hearing that correctly?
We're going to have a map just like this every Thursday. And then it'll be based upon a 2-week rolling average. So based upon where you are today, those towns that have a positivity of 15 or more per 100,000, we're thinking about giving them the discretion to opt out of phase 3. That would be Wyndham, Preston, Norwich, and New London.
And how long would they opt out of phase 3?
I think you have a 2-week rolling average, and hopefully they get down below that 15, and that would allow them, that would probably mean they could go to phase 3.
So they would stay in phase 2 until their metrics are below that level?
That's right, at their discretion, that's right.
Okay, and Governor, I just want to ask you about your meeting with Dr. Birx today. You were highly critical of the White House response to this for a long time. After meeting with her today, do you feel more confident about where their response is now?
Look, there's a political group on the COVID task force, and there's a scientific group. And the scientific team, I'd say, is led by Dr. Fauci, who joined us about a month ago, and Deborah Birx, who I obviously thought was very helpful in our discussions today.
All right, thanks, everybody.
WTIC 1080 News.
Hi, Dr. Gifford. Hartford now closing athletics fields starting next week and considering a rollback in access to the school buildings. What are you hearing from the capital city at this point?
So Hartford has been inching up in their case volume, and lots of credit to the leadership there and their local health department for really keeping a close eye on what's going on in the town, and a really strong partnership with us at DPH. I think they're wise to take some of those steps, particularly if, their contact tracing and information on the ground indicates that those might be places where they're seeing lots of contact, or where people are not, wearing the mask and keeping their distance. I think one of the things we've learned around the country that the governor and Dr. Birx were referring to is the earlier you act when you see some of this signal, the easier it is to turn things around. So I applaud them for taking those steps, for keeping such a close eye on the metrics in their town, and for making the public aware that things are starting to go in the wrong direction.
Mr. Governor, I have to ask you about a major story nationally today outside of the election. Domestic terrorists arrested for threatening the governor of Michigan. Have you heard of anything like that here? And what can be done to cool off the sort of national fever that's going on?
Yeah, cool the rhetoric. I think in this political season, there's a lot of hot rhetoric. Frankly, I think the president should really tone it down, set the message. I think a lot of people listen. But I've not heard anything here in Connecticut. I will tell you that I loved being there for the graduation of, I think it was the 129th class of state police. One of our largest class, one of 3 classes we're going to have over the next 12 months, most diverse class of state police we've had. And we did talk about how they're graduating into an incredibly complex world, complex environment, and I salute their heroism every day.
Fox 61.
Hi, Zinnia Maldonado from Fox 61. My first question is for Commissioner Gifford. You talked a little bit about this previously, but could you get more in depth about the similarities between Norwich and the situation happening now in New London with the spike in cases?
Well, I think they're similar in that, they're obviously in the same general geographic region. And they are similar in that there's not a particular focus or thing or event or group that we can point to where this is sort of concentrated. This does seem to be community-wide spread. So what they have in common is that collectively, the residents and citizens of those 2 towns really need to think about, if you have chronic conditions, if you're at high risk, you really need to think about limiting your activities right now. Stay closer to home, be extra careful about the distancing and the masks. As Josh was pointing out, it's time to think about getting tested if you live in one of those towns, and even if you have no symptoms. Take advantage of the testing opportunities that the state is setting up in your towns, and go out and take a test. It's easy, it's quick, and can be a tiny bit uncomfortable, but I think if you live in one of those towns, and particularly if you have a high risk condition, you might want to consider getting tested. This is something that is collective action is really going to be helpful here. People working together, reminding one another gently to follow the rules, pull your mask up over your nose. That's a common one. We see people walking around with the mask under the nose. It doesn't work quite as well. So just all of us working together and pulling together, I think, is something that those two places have in common.
And then, Governor, we had previously asked about assistance to small businesses still struggling, and you had mentioned you would be announcing information about new loans. Is there any details about that now?
We've obviously done the shared work that is up and operating. We're going to continue to promote that in a serious way. But we got David Lamont, are we ready to roll out our loan program?
Almost, Governor. So yeah, we are working on finalizing a program to provide further assistance, really focused on the smallest businesses in the state and those businesses where their revenues have been most impacted by COVID. So I'm hopeful we can roll it out quite soon, certainly within the next week or so.
The Associated Press.
Thanks, Max. I just want to clarify, what is the positivity rate now in Norwich? Because I thought it had actually declined. Wasn't it around 7-something% and then it dropped down to 3.5? So what will be the benchmark for these communities when it comes to stopping the phase-in of the different reopenings?
You have that number?
Yeah, so the positivity rate over the last 14 days is still about 7 in Norwich. But the thing to keep an eye on is as we bring in more testing, as we have done over the last week and a half, you would expect that we want to see that positivity rate go down, but we may still be identifying more cases. And that's why the case rate per 100,000 is the metric that we're looking at this town by town level data, because as we bring in more tests, you increase the denominator in that positivity rate. But that does not necessarily mean that you're bringing down the rate of infection in the community. So we're going to be looking at that case rate, the number of cases identified, as long as we have sufficient testing there. But we will obviously continue to keep the eye on the positivity rate, certainly at the higher levels, the state level as well.
So how long does it take to figure out if it's showing any signs of slowing down?
Well, we'll continue to look at it every day. And as the governor mentioned, we'll publish these town level metrics every week. As we saw from Danbury, and frankly, we saw back in the spring, right? These trends don't turn on a dime. As Commissioner Gifford mentioned, you have to take action early to bend that curve. And, we're optimistic that the actions that are being taken in Norwich and in New London will help do that.
Thank you. And Commissioner Gifford, are you making any sort of recommendations to nursing homes in Southeastern Connecticut to maybe ramp up testing or maybe scale back visitation?
Yes, we took that action last week. We reached out to our state contracted testing partners and to all the facilities in that area, and they're all now doing weekly testing. And the visitation rules are imposed by our federal partners at CMS. So we don't have the discretion necessarily to scale that back, but we have been, until the entire county gets over a 10% test positivity rate, and, which would obviously be very, very high. We're not in that zone yet. So the visitation won't be scaled back, but we are really advising the facilities to be vigilant with the screening that needs to be done. And they can offer testing to visitors with some of the machines that the federal government has given them.
Okay. Thank you very much, everyone.
The Day of New London.
Thanks. Both my questions are for Commissioner Gifford. So the first is, are you finding that people are being receptive to the contact tracing? Are you having any issues with people sort of calling them back or concerns about privacy, as we kind of heard about in the beginning?
Yes, we continue to hear concerns about privacy, but I will say, we look every week. We look at the average number of contacts per case that we interview, and that number has been creeping up ever so slowly over the past weeks and months. So we are now getting more contact information from the individuals that we speak with. We're also able to reach more people that we reach out to every week. That measure sort of creeps up a little bit. So I think people are becoming familiar with the idea of contact tracing, and we're getting, and I want to say thank you. Thank you to all of you who've picked up the phone when you get that call from CT COVID Trace. Your information is confidential. The Department of Public Health does not share it with anybody. And we only use it to do contact tracing. So we use it to protect you and to protect those people who may have been exposed to you at a time when you didn't know you were sick.
Thanks. And then the second question is that it sounds like in Norwich and New London, the cases, the indication there is that it's these informal social settings that are leading to the spread, potentially that Dr. Birx warned about. Is that correct?
Yes, that is correct.
All right. Thank you.
The Waterbury Republican American.
Yeah, thanks. I just got a couple more questions on this discretion issue. Okay, you established the threshold at 15 per 100,000. Now then, will towns and cities who meet that threshold then have to apply to some state agency or the governor's office to roll back these, or reinstitute the previous reopening rules? And how would they do that?
We've said phase 3 is as much as you're allowed to open, but in those areas that have that higher daily cases, like the 4 towns we just mentioned, we're thinking about allowing that to be at their discretion. They wouldn't have to apply; they would do that. Just the same way you saw a number of towns decide to go to distance learning in their schools during the near term.
But would there be any kind of reporting requirement?
We certainly stay in very close contact with those mayors. We get a very good idea of exactly what they're thinking about. We talk to them all the time. In terms of formal reporting requirement, I don't think so.
Okay. And this is going to be accomplished through a coming executive order if you indeed decide to proceed with this plan?
That's right. Right now, the executive order says we're moving to phase 3 on October 8th, and that's what everybody's going to do. We're thinking out loud with you about the idea of allowing some of these towns with a higher infection rate the discretion to not go to phase 3.
And I believe, I just want to confirm what I heard. I thought I heard earlier that towns and cities will have the opportunity to say, well, we'll enforce this phase 2 rule now. But you can still have the gathering limit for this particular activity for phase 3, say like a worship service. As you know, you can have the current limit on a worship service for phase 3, but restaurants have to go back to 50% capacity. Is that the sort of thing that towns and cities will be able to do?
I don't think we've gotten that level of specificity. I got to say, Paul, that sounds pretty complicated. Either you want to go to phase 3 or you feel it's the cautious thing to do to stay at phase 2.
Well, no, what I'm getting at, I guess, Governor, is a town might say, well, it's okay for the religious service limit to continue what it is in phase 3, but we're concerned about restaurants, so restaurants have to go back to 50% capacity. Or the other way around, restaurants are okay at 75%, but houses of worship, you're going to have to go back to the limits that were applicable during phase 2. That's what I'm asking.
Yeah, let us get back to you. We're just began thinking about whether everybody goes to phase 3 or some have the discretion to stay at phase 2. And for those, it gives good incentives for those towns to really enforce the protocol strictly, be it at the houses of worship or the restaurants, just so everybody can get to phase 3 and get their schools open again.
And I was just looking at the numbers in terms of the case reports for like the first of the month. Between July and August, they went up about 3,600. August to September, 3,400, 3,000. Between September, 3,000 and some change, and it looks like between the beginning of September and now, it's 6,200 plus more cases. Isn't that sort of the sign of what Dr. Birx was warning about? Cases ticking up, community spread preceding, hospitalizations and all of this sort of stuff?
I think it's a sign of the fact, and you heard, all of our scientific team going back a few months, Gottlieb and Co., et cetera, talking about the possibility of fall being a riskier time and some uptick, probably related to cold weather. You see what's going on in Wisconsin and some of those other colder weather areas there. So we're not going to let that happen in Connecticut, at least do everything we can to avoid it.
I'd also just point out, Paul, that we have continued to significantly increase the amount of testing we've been doing in Connecticut. So, with today's results over the last 7 days, we've reported 136,000 tests in the last 7 days, which is an all-time high. So, we continue to, I think, identify even more of the cases that are out there, even asymptomatic cases, than maybe we did over the summer.
Okay, what's the rolling 7-day positivity rate today then?
1.4%.
1.4, thank you.
CT News Junkie.
Thanks, Max. Hi, everybody. Governor, I guess some people could find these two news stories a little jarring, right? Here we are moving into phase 3, and on the same day, we're also sort of reporting that there's this new outbreak in New London. Can you just sort of speak to that dichotomy? Are these localized outbreaks just sort of a fact of life now?
It's something obviously we're watching very carefully. I take some comfort by the fact that, yep, we've crept up over the last couple of months. We've still been in and around 1.4% for some period of time, which is a very low number. And I think, again, I was heartened by the fact that looking around the rest of the country, that the workplace and the schools and the churches, the places that we are continuing to open, are not the places where the infection is likely to be. It's much more likely those informal social interactions.
I think it's also worth noting that, if you go back and you can look on our website at that map of the state that the governor had up earlier, the vast majority of the state continues to be, in very good position with less than 5 cases per 100,000. Pretty much all of New Haven County is below that level, all of Fairfield County, with the exception of Fairfield, which is really an artifact of Sacred Heart and Fairfield University with some cases on campus there. But, as a state overall, we continue to be in a very good position, thanks to, all of the hard work and of our citizens and our local leaders.
Hey, Josh, I just reinforced that. We talked about Norwich and Preston going to distance learning because of the higher infection rate, but it's worth remembering that Bethel, Canton, Coventry, Simsbury, Darien, New Canaan, towns and all over the other parts of the state are moving from hybrid to a full-time in-classroom experience. So I think you're seeing what's going on in the rest of the state is very positive.
Great, thanks. Governor, any plans to host any Halloween-type event at the mansion? Pass out any candy at a distance?
I think the jury is still out on that because we got really good candy, so there can be hundreds or over 1,000 people there. And while obviously we're going to have trick-or-treating in a socially distanced way around the state, which I think is great, whether we do it at the governor's residence or not, let me get back to you.
All right, thanks, everyone.
Hearst, Connecticut Media.
Thanks, Max. Governor, did Dr. Birx make any remarks on President Trump's personal behavior during his infection period, removing the mask, saying it's not that big a deal, things like that?
Didn't come up, surprisingly enough.
She didn't say anything along those lines in private or anything?
No, but she certainly is somebody who emphasizes the importance of wearing the mask. We had the mask on throughout our meetings, all of our social interactions. She knows the importance of doing it right.
Oh, she does then, huh? Okay. Maybe her boss doesn't. Hey, David, so Connecticut's only major league team from our sister city in Toronto, we're going to be able to see their games in phase 3 or what?
So, Ken, I'm very hopeful that the November 1st game, there will be tickets available. So we're finalizing that with them as we speak. But please save that date on your calendar.
And I must add, there will be our second major league team, the Connecticut Sun, who had a great run in the playoffs, played a great role in the WNBA and made it to the semifinals, Ken. So I want to make sure you don't forget about that.
I apologize. They're, yes. Busted. I'm busted. Thanks a lot. Thanks, Max.
The Hartford Current.
Hey everyone, this is Emily Brindley from The Current. First thing I wanted to ask is about those 4 towns that you are possibly recommending they stay in phase 2. When will that move from something that you're thinking about to something that they can actually act on? Is there some timeline on when they may actually get permission to remain in phase 2?
Early next week.
Okay, so just to be clear, they're going to be required to be in phase 3 for at least a week.
That's right. Whether anybody goes into the restaurants right now, just because you're allowed to be at 75% doesn't mean you got more than 25% occupancy. But we're going to clarify how much discretion the towns have within 3 or 4 days.
Okay, and Governor, can you explain to me a bit about why you have decided now to allow different municipalities to follow different rules? Because back in mid to late August, Mansfield in particular was requesting permission to have different restrictions, and you said at the time that you really didn't want to fall into a patchwork of policies, but you're now talking about a patchwork of policies. So what has changed?
That's a fair point. I think in April, May, where you saw the pandemic going right up the I-95 corridor, spreading around, we didn't know exactly how fast it could go into Southeast Connecticut. We were learning a lot at the time. I think now, here we are in October, we've seen the nature of these outbreaks has tended to be somewhat localized, and we think we have some capacity to contain it. You know, that said, we are looking at Eastern Connecticut. So that's why at this point we're saying I think we can give some discretion locally, and it follows on what we're doing with schools and sports.
To clarify, though, what Mansfield requested that different restriction in late August, not in April or May. So what has changed since late August?
Well, remember, I mean, right now we're saying you can go from a 75% to 50% capacity. Back early on, we were trying to make sure that everybody didn't want to drive from Darien to Willimantic to get a Scotch and soda. We thought that would not be good in terms of having some places with the bars open and other places with the bars closed. I think this is a very different situation. We're trying to fine-tune exactly the opening strategy at some of these locations.
Yeah, and Emily, I think one other thing I want to add is Mansfield and these towns made an official request through our executive order process to DESP, and it was reviewed. One of the things that we have seen in terms of those towns that were putting those requests, they were looking to do that proactively for what they felt was going to be a spread based upon the college communities and the colleges which are within their towns. I think one of the things that the governor has seen and DPH have seen is we're looking to address these specific direct outbreaks that are happening and be proactive on that end. And that's the reason why that we're looking at all these various options. And we'll have more information next week.
So is it fair to say that you weren't willing to put different restrictions in before an outbreak started, but now that outbreaks have started, you're willing to put restrictions in place?
No, I think what we're saying is that we were reviewing each situation individually and based upon those requests that was made by those towns. I think one of the things that we have seen is how we've addressed some of these issues that have come up in other towns, specifically Danbury that came about. And we're, like I said, as the governor has stated and DPH has stated, this is a virus that is ever moving. You're learning something new every day, and we're looking to make sure that we're staying above it.
Thank you.
Connecticut Public Media.
Good afternoon. I spoke with a venue owner today, and they're celebrating. They finally have the phase 3 opening where they can have 100 people. But now, what if that venue is at a town where they're at the discretion to go back to phase 2? How do you plan for that?
I plan for that everybody's going to be on the same page, do everything we can to get that town to a lower infection rate so they can open up that event venue. I mean, I think that's just what the strategy is. But I think if you find the event venues are going to do very well in about 95% of the state. I hope they take that responsibility very seriously in terms of making sure the protocols are all followed.
Yeah, Governor, the one thing I would just add is we've always been very clear that the progression from phase 1 to 2 and now 2 to 3 is going to be subject to the data. And we have seen an uptick across the state, in particular in certain areas. and we're trying to provide very clear metrics on where that data needs to be to make you opt into phase 3 automatically. And 15 cases per day per 100,000 is that number. It affects 4 towns in the state, but we're hopeful that those towns will address it and the transmission will be lower. But this has always been subject to the data, and that's been clear from May.
And this might be a question for Josh. When is the app going to be available on the phones in Connecticut to notify you if you're in contact with someone who tested positive for COVID? I know you mentioned it last week. What's the timeline for that?
Yeah, as mentioned previously, we're aiming to have that functionality turned on by the end of this month.
Thank you.
Welcome.
The Connecticut Mirror.
Governor, if you give the towns the discretion, who will you be giving that power to? Elected officials or the local public health directors?
Elected officials.
Elected officials. Why? Why not the health directors? Why not the professionals?
Because I think the elected officials working obviously with the public health people, Deirdre is probably looking right now, but they're the ones that are enforcing the rules. I've got to make sure they're vested in the rules we got out there, make sure we're all on the same page in terms of what we're asking them to enforce, because enforcement is going to be really important over the course of the next couple of months, and I think the elected officials are the ones that have the lead responsibility there.
You're not afraid that that then becomes a political decision instead of a public health decision?
I think it'll be informed by the public, and every town is a little bit different, but I've heard from a lot of the mayors that I think they appreciate having some discretion in their particular circumstances. They understand that their town could be at risk, and they want to have a little more discretion in terms of being able to keep that pandemic under control within their borders.
And just to be clear, the only thing on the table right now is giving them discretion. You are not talking about requiring that towns that hit those thresholds that you've already laid out, that they have to remain at phase 2. Is that correct?
Right now we're talking about just the possibility of giving them that discretion. Exactly.
Thank you.
All right, I'm getting the signal here from Max. Thank you, guys. In terms of what we're doing on this next phase, I just thought you might enjoy this picture with Dr. Birx. I admired her silk scarf, and she admired mine, actually. And but she did make an interesting observation as we were down at UConn Hartford, and these two very different pictures. And I pointed to the one, which is at least on my left, which is LBJ coming to, to Hartford. And she said, that's what we used to think of as the super spreader event. And then we pointed to the other photograph there, which is also in Hartford. More likely today, we're seeing lots of these local, smaller interactions. These are the super spreader events because they happen hundreds of times all over our state. I thought that was a great observation. I really appreciated her coming to visit. Thank you, everybody.